Many women don't know much about perimenopause, but perimenopause is the time between menopause and fertility, basically. And so it's not this magical time frame that's just 1 month where one day you have a period and one day you don't have a period. Perimenopause can last 6 months up to 10 years for some women. And so perimenopause is the most difficult time to treat hormones because the hormones aren't exactly in the fertile range, they're not exactly in the shutdown range of menopause. And so one of the most difficult times to control hormones is in the perimenopause area. But there are things in functional medicine that we can do to help you through those symptoms of perimenopause. Try to balance the hormones while your ovaries are going up and down before the shift of menopause. So if you're in your upper 40s, anywhere in that 40 to 50 range, average age of menopause is 51 and a half. So perimenopause is anywhere from 40 all the way up to 51 and a half or later if you're older, if you're later than that. But basically, if you're in that age range and you're worried about anxiety, depression, because it's a sneaking symptom of perimenopause, instead of running and getting on Prozac or sertraline, Zoloft, any of the antidepressants that your regular doctor might suggest, consider doing testosterone replacement or progesterone replacement in order to help minimize the symptoms of the perimenopause.